If you could swipe a clear liquid across sore skin and within minutes ease pain, fight infection, and ferry healing compounds deep into your tissues, would you try it?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're spotlighting dimethyl sulfoxide, DMSO, and the solid science behind its most effective combination therapies.
I'm Alara Sky, here to unpack how DMSO's rapid skin penetration amplifies medicines for chronic pain, resistant infections, sports injuries, and more. We'll keep our dialogue direct and practical, so you can decide whether the documented strategies match your own health goals.
First, DMSO isn't just an anti-inflammatory. It revives struggling cells, clears swelling, and improves circulation. Thousands of studies link those traits to relief in sprains, burns, nerve injuries, autoimmune flares, and degenerative joint pain. Yet its most dramatic results appear when you pair it with targeted agents that do what DMSO alone can't.
That synergy starts with transport. Once DMSO touches your skin, lab work shows it spreads throughout your body in under an hour, carrying dissolved partners with it. This allows heparin, certain antivirals, and even chemotherapy agents to reach tissues other delivery routes miss, often at a fraction of the usual dose.
Let's look at heparin first. German clinicians blended 10 to 15% DMSO with 50,000 IU of heparin plus dexpanthenol to create dolabine gel. Trials on 78 athletes with tendon overstrain reported 94% pain relief, over 50% less swelling, and near total reduction in redness and warmth after 3 weeks of thrice daily use.
Beyond sports medicine, dolabine excelled in vascular recovery. In post-varicose vein surgery patients, every evaluable case rated results good or very good after a month. Success sparked sister gels, Sportisol, Synodol, Rollbean, across Europe and Russia, each confirming that DMSO heparin restores circulation while calming injured tissue.
Non-steroidal anti-inflammatory drugs follow a similar pattern. The U.S.-approved formula. Pennsaid mixes 45% DMSO with diclofenac. Controlled trials found DMSO alone cut osteoarthritis pain by about 28%. Adding diclofenac raised relief to nearly 40%, with negligible systemic side effects compared with oral NSAIDs.
That local delivery matters. Oral NSAIDs contribute to gastric bleeding, kidney strain, and cardiac events. Yet Pennsaid's topical route bypasses the gut and slashes bloodstream exposure. Patients gained equal or better pain control with lower overall drug burden, a pattern repeated in foam-based ibuprofen DMSO studies.
Steroid partnerships show even greater potency multiples. Early lab work demonstrated that 0.025% fluocinolone dissolved in DMSO matched the effect of a 10-fold higher standalone steroid. Clinicians leverage that boost to clear stubborn plaque psoriasis within 4 weeks and to ease rheumatoid inflamed joints faster than DMSO alone.
Psoriasis trials highlighted another benefit. DMSO countered the irritation sometimes triggered by high steroid concentrations, allowing sustained therapy without the occlusive dressings formerly required. In rheumatoid arthritis, combinations with heparin, sodium salicylate, or hydrocortisone outperformed solo DMSO, giving quicker pain reduction and better joint mobility.
Antiviral history is just as striking. The nucleotide analog 5-iodo-2 prime deoxyuridine, 5-IDU, barely penetrates skin on its own. But when dissolved in high-concentration DMSO, it cut shingles pain from days to hours and shortened healing time by more than half. Later comparisons showed 40% DMSO plus 5-IDU drying vesicles faster and preventing post-herpetic neuralgia better than a cyclovir.
DMSO also strengthens acyclovir itself. Laboratory data reveal higher local drug levels and quicker lesion resolution when the antiviral rides with DMSO, again without raising systemic exposure. Those findings revived interest in topical management options for recurrent herpes and stubborn shingles outbreaks.
Oncology offers another example. A 5% 5-fluorouracil solution in DMSO proved potent against keratoacanthoma, superficial basal cell carcinoma, and early squamous cell carcinoma. Foundational evidence for modern products like actikerol, which treat actinic keratosis by uniting 5-FU, salicylic acid, and unadvertised DMSO.
DMSO also breaks antimicrobial resistance barriers. In vitro, 5% DMSO restored sensitivity to antibiotics in colistin-resistant Pseudomonas and boosted aminoglycoside potency 200-fold against lung pathogens. Guinea pig studies of isoniazid-resistant tuberculosis showed survival only when DMSO preceded the antibiotic, indicating a path to disarm superbugs.
Persistent fungal infections respond similarly. By dissolving agents like terbinafine or ivermectin in DMSO, clinicians reach nail beds and deep dermal layers, clearing onychomycosis that resisted months of standard treatment. Reports of rapid nail recovery underline how transport plus antifungal action accelerates results.
The common denominator is efficient delivery. Smaller doses hit therapeutic levels in hard-to-reach tissues, lowering toxicity and making injectable-only compounds practical as lotions, gels, or nebulized mists. That versatility lets practitioners tailor combinations for musculoskeletal trauma, neuropathic pain, lung congestion, and localized cancers.
Despite decades of favorable evidence, U.S. regulators long branded DMSO unsafe, largely because it couldn't be patented. Ironically, once pharmaceutical companies embedded it inside proprietary gels, the same substance became safe and effective. That paradox left generations unaware of a low-cost therapeutic tool hiding in plain sight.
Today, political shifts and patient demand are reopening the conversation. As clinicians re-examine unpatentable remedies, DMSO's documented combinations offer a bridge between conventional drugs and integrative practice, making care both more affordable and more precise.
Before exploring any protocol, read the dosing guidance in the source article and discuss specifics with a knowledgeable professional. Concentration matters. Pure industrial-grade solvent is not intended for topical health use, and mixing ratios determine both penetration depth and comfort on your skin.
Here's your challenge. Choose one lingering pain, skin lesion, or infection you're addressing now. Read the section of the article describing a DMSO combination that fits. Note the exact concentration and companion agent, and bring those details to your next appointment so you and your practitioner can decide whether to integrate the approach safely.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.